Hey guys, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much, much more. Had a couple questions from a couple patients who were mentioning, talk about thyroid and other hormone issues, and what should I watch out for? What are the big symptoms? A lot of people know about the symptoms. We all know about how important the thyroid gland is, and one of these questions came up like, what are the things I should be watching out for if I have a condition or if I feel fine or if something changes, what should I be on the lookout for just in case, say you have a family history as we're getting older or some other issues, and then you start to get some symptoms. And obviously there's a lot of them, but these are some of the biggest ones that I'm going to talk about here. So I'd say the biggest three, right, are things like weight gain, fatigue, and cold extremities. Those are kind of like the three of the classic ones, right? And obviously all these things can be caused by other things, especially weight gain, of course. Big issue with everyone today. A lot of my clients are coming to me for weight gain issues, but weight gain, especially if it's new or something that's not changing, or you're trying a lot of different things but nothing's working. This might be, it's one of the missing things. Now, on the flip side, a lot of people is like, oh, it's your thyroid, and blame for everything when you can't lose weight. That's not always the case. A lot of times it's not it, but this is sometimes a missing piece. So weight gain, fatigue, especially in the afternoon, especially as you're getting fatigued as the day goes on. You're getting tired more than usual, and you don't feel that tired, but now you're starting to kind of be dragging, where you're just kind of tired all day long, but especially picks up later in the day. Now, if you're kind of just wiped out in the morning from as soon as you get out of bed, that could be more of an adrenal issue, or obviously a million other things. But in terms of hormonally, oftentimes classically, it's more later on in the day in the afternoon. But that's one thing to look out for. Cold extremities are notorious, especially hands and feet. If your hands are always cold, or if you're always cold, you're always wearing a sweater, and nobody else around you is, or if it's just your hands and feet that are constantly cold no matter what. That could be an indication too, but because of course the thyroid is intimately involved with metabolism, body thermoregulation, body temperature, etc., and many other things related to your metabolism. So that's a big one as well. Weight gain, fatigue, cold extremities, dry skin, dry hair, brittle nails, brittle hair. That's a common one as well. A lot of it has to do with perfusion and the absorption. You get accumulation of fluid. A lot of people, and classically, if you read some of the older books, people get like this myxodematous fluid. They get some fluid retention, some edema in their legs, and their skin gets dry, or they get puffy. Their skin it's very brittle, and that can be another indication as well. Hair loss, of course, hair loss too is another one. In addition to just being dry and thin, a lot of people, especially women, can get hair loss. Now, hair loss can be underactive or overactive thyroid, but most commonly, most people we deal with are having underactive thyroid or hypometabolism or full-blown hypothyroidism per se. So that's another common one as well. And then some of the other ones are like weakness, especially proximal weakness in the proximal muscles, getting out of a chair, things like that, or achy joints. So weak and achy muscles, achy joints. This is another one too. It's a very common issue, especially as we get older. GI obviously affects your GI. Constipation is a big one. Again, typically people with underactive or hypometabolism, think of things that everything's slowing down. The skin's getting dry, your muscles are getting fatigued, you're getting fatigued, your gut's not moving through, so you're getting constipated, and that's no fun. So that's a common one as well. Brain fog, or kind of problems with memory, recall. You just feel like you're in a haze, just not thinking clearly. Again, things are kind of slowing down. That's another common one as well. So mental issues, cognitive issues, memory issues. People describe it, they call it the brain fog, right? Mood changes, especially decrease, like dysthymia, or even full-blown depression, or just depressive symptoms, just kind of dragging, just down, and in the blues, just not feeling up to doing anything. That's a common one too. Mood changes can be a very common indication or a sign of thyroid issues as well. Obviously, the last one's more of a lab thing, but increased cholesterol, right? And I'll get into this on other videos as well as to why this happens, but oftentimes get an elevation in cholesterol, and the bad cholesterol, right? The ApoBs and LDLs and things like this, and your good cholesterols are not, they should be higher, like your HDL typically are not. So basically a dyslipidemia, the things you don't want are starting to become apparent. So these are some of the big ones. Obviously there are other signs and symptoms too, and obviously some of these things could be caused by other issues as well, but someone had asked me this question, I wanted to answer that. So these are some things to look out for. If you're concerned about having a thyroid issue, or say it runs in the family, everyone in your family has it, and you haven't been diagnosed with it yet. So what do? Obviously, come see someone who's trained in hormone management, come to an expert like myself or one of my colleagues who knows true hormones and inside and out. I practice cellular medicine, hormones. I deal with hormones, I deal with peptides, cellular medicine, longevity, and be above and beyond. I treat things at the cellular level, right? And so that's what we want to fix. We don't want to just cover things up. We want to figure out what's going on at the cell level and fix it. And that's what we're going to do. We're going to do a deep dive, do an extensive history and examination, ask all the right questions. Of course, we'll always do a laboratory analysis too to look, and you want to look at the right things. A lot of times patients come in and say, oh, my doctor said my thyroid is normal. Well, I've talked about this before, right? Normal is not optimal, huge difference. And oftentimes normal is not normal, okay? There's huge individual and intra-individual variation on lab tests for everything, but especially for the thyroid, right? Because it's just a conglomeration of people. You don't know if those people are average, if they have sickness or thyroid conditions or not. So it's really not, everyone is different. So you have to look at their symptoms, actually talk to the patient, feel the patient, and see what their skin feels like, what their thyroid gland feels like, what kind of symptoms they're having, and then look at their lab tests. And again, obviously normal is not optimal. And a lot of times they're just looking at a TSH and that's it, which is not a good indicator. And I'm going to do some future videos on that, but free T3, free T4, reverse T3, I may even look at like TPO, anti-TPO antibodies, and look at your metabolic profile and panels as well, and other things as well. So, and then you have to get in treatment, and that's a whole nother discussion. But anyway, so that's a quick thing on what to look for, what to do next. Reach out to me. I'm happy to do telemedicine on you, and reach out. I'm seeing patients all the time with my telemedicine. Check out drericprimex.com. Also doing the ultimate dual consultation with my partner, Ali Gilbert, where we look at everything: nutrition, fitness, hormones, peptides, true regenerative therapy, true anti-aging, age management medicine. We're prolonging living, want you to live better, stronger, faster, and perform better. Not just live longer, but live better. So it's about living your prime life, living prime, and giving and living to give, giving back so you feel good about yourself, so you can give back to other people, and then they feel good, and it spreads in a beautiful, beautiful rhythm. That's what I'm all about. That's what we are all about. So like this post, tag it, share it. Let me know what else you want to talk about, and I will talk about. I want everyone to have an awesome day. We'll talk to you soon. Bye.